Hello, everybody. Thanks so much for joining us here on this live stream. We are just so delighted to be with so many of you. And I just want to give a special shout out to all my dear, dear TB fighter friends and my nerd fighteria friends. You have inspired us so much, especially with our last few days at TB Hill Day. So thank you for everything you do. My name is Joia Mukherjee. I'm a physician. I'm the senior advisor for clinical and academic strategy at Partners in Health. And today we're going to be talking in this webinar, which is off the public record and it is being recorded. And we want to give you an understanding in this current moment of uncertainty in global health and what the administration is doing, how we think about this, what it means for the patients we serve, the most vulnerable, and how all of you can be part of fighting back and assuring that the gains that we've made in the last quarter of a century in global health continue to move forward and that we don't slide back. Over the past year, billions of dollars for global health have been cut or unconstitutionally withheld. They're sitting, being wasted in coffers. Care continues in the communities we serve. And importantly, there are many actors in global health, particularly local communities themselves and the governments in the global south that are doing the best that they can. And PIH, in many cases, is trying to help to glue together in the gaps and fill those spaces. But we really need you. A spending bill was just passed by Congress in February. And luckily, because of your fantastic advocacy phone calls, visits with your representatives, global health funding has been maintained or even fully restored. And we are really working on continuing that, adding that, and putting much, much more transparency into where the money is going. Because as I said, it's just kind of sitting there, and that's one of our biggest concerns. And so that's what we'll be talking about today. Again, thank you to all of you. Without this movement, and again, I just want to say, having come back from TB Hill Day with my friends Taylor and Lex and so many others, it was just so moving to see that this civil society movement for vulnerable people who many of you have never met, and yet you care so deeply that out of your own pocket you came to Washington, and we all feel so buoyed by that and how government should work and can work if we demand it. So as we approach this new America First strategy, trying to understand what that means, you'll hear from our panelists. The US is negotiating bilaterally, country to country, with countries, and we've learned some of that from Rwanda and Sierra Leone, who have signed these bilateral compacts. And we have to keep building our movement, building health as a human right, despite these cuts, and not retreating on the broad ambition that everyone deserves the right to the healthcare that they need. We're so excited to be joined by three amazing panelists today. Joel Curtin, our Director of Advocacy at Partners in Health, who has been just a tireless voice behind the scenes for many of these policies. Rosie Poling, who is a health policy officer at PIH and was one of the major, major engines for our TB Hill Day, among other many, many things she does. And then Dr. Stephanie Saki, who's a senior fellow, distinguished senior fellow at the Brown University School of Public Health. I'm going to have you start us off, Rosie. If you could share some of the realities, which you know well, about the current state of U.S. foreign aid and spending. Go ahead, Rosie.
Yeah, thank you, Joya. So as many of you know, we're in a very challenging moment for global health. Last year, we saw huge attempts to dismantle much of the system that exists. And now, as you mentioned, we're seeing this push towards the America First global health strategy. That is a model that doesn't align with a lot of PIH's values. So last year, in January, we saw that the Trump administration issued an executive order that paused all funding for foreign assistance programs. And by the spring, USAID had terminated 86% of contracts, leading to many gaps, including major staff layoffs, loss of social support programs, drug stockouts. And new data suggests that these consequences are really enormous, where the reductions in spending could have resulted in an additional 500,000 to 1 million deaths this past year, which is really concerning and something that I know weighs heavily on all of us. However, I was encouraged by how PIH supporters and others mobilized against these cuts. One of our campaigns focused on the rescissions fight last summer, where Congress considered a $9 billion proposal to claw back for foreign assistance funding that had already been approved by Congress. The House passed this package, but several Senate Republicans really pushed back, particularly focusing on PEPFAR, which is a program that supports global HIV funding. And they demanded the removal of $400 million in cuts to PEPFAR. This is a place where advocacy from PIH supporters really mattered. The calls, the emails, the outreach, like really gave Congress the ability to push back against this by demonstrating the massive life-saving impact of programs like PEPFAR. While other programs and development programs within that assistance were not spared, this work really does show that these cuts are not inevitable and there is power in our voices. Joy mentioned a little bit about the what's coming next, right? So this was kind of last year, this huge dismantling. Now we're moving into a place where there's something new being pushed. The America First global health strategy that's attempting to redefine global health emphasizes bilateral agreements that are designed to directly benefit the United States and advance US national interests. So currently, these agreements are being negotiated with over 50 countries through memorandums of understandings or MOUs. There's a few things in these negotiations that are raising some red flags for us. One is the lack of transparency. Many of these MOUs are not publicly accessible and making it difficult to understand how the funding decisions are made, how the aid will be used. And in some cases, civil society groups are been excluded from the process of designing these, leading to leaving out key populations from the priorities. In some places like Malawi, the ministries of health have also been left out of negotiations, which is really troubling. We're also concerned about how these are becoming increasingly transactional. They really outline in the strategy is a desire to access Africa's key minerals and rare earth materials. And we're seeing in Zambia, for example, that with this, there's a huge reduction in funding, and also the access to medicines is linked to mineral access. There are also concerns about data sharing with pushback from some countries, from like Zimbabwe and Kenya. So some countries are trying to figure out how to mobilize and respond to this. The other major concern is the funding reductions. While the US routing more funding through governments and requiring increasing co-investments could be good, we're concerned about the speed and the lack of contextual understanding in these reductions. Across MOUs, our team at PIH calculated about 2.5 billion in funding reductions out of the 12.4 billion portfolio every year, which is a huge reduction in funding that will directly harm patients. One example of one country facing these cuts is Burundi. They have a 55% reduction in one of the most resource denied countries in the world, where health expenditure per person was $25 per year, which is already not enough. And with these cuts, will decrease even lower. We're also very concerned about the sunsetting of PEPFAR. There's major changes coming, especially through PEPFAR grants that flow through the CDC that fund a ton of care delivery. And this is like really concerning for many folks, both in PIH countries and around the world. So PIH is trying to track all these changes that are happening with our colleagues around the world. Really grateful for their partnerships. And we're aiming to influence this process and push back where needed and push for a different vision of a future through grassroots mobilization and through high-level actions, like our team in Zamila Sante hosting a congressional briefing to share the stories from patients to members of Congress and influence them. But we are in a very challenging place, and so the partnership in this time is really essential.
Thank you so much, Rosie. And, thank you for all your leadership on this, your attention to detail and your attention to building our movement. We're so grateful. I want to go to you, Joel, to talk about, what we're working on largely. I mean, Partners in Health has been in many ways a critic of traditional aid. We did not want the rug to be pulled out so abruptly, but how do we think about this in the bigger arc of what we want to do, which is move beyond the aid framework toward real financing, durable financing for health systems? Joel?
Yeah, I mean it's such a key question, Joia, and I think these attacks on foreign assistance, on aid, it's really what we reflect on as being an acute on chronic crisis, right? And so the acute situation being this immediate and immense suffering caused by this withdrawal and withholding of funding, as Rosie really described very well just now. And then to your point, Joia, the the chronic underlying issues being, these ongoing colonial and extractive arrangements that prevent countries from fully financing high quality healthcare and public services in the first place, right? So we can't see these things as being separate, but actually intimately linked and intersectional. So of course we need to do, and we are doing everything, as Rosie just mentioned, everything that we can to fight and address the immediate harms and unnecessary suffering that's being caused by this really reckless removal of funding. But at the same time, the rapid and uncoordinated withdrawal of funding has really reflected and revealed these unjust, deeper structures, which really facilitate the enormous outflow of resources from global south countries to the global north, which really is the necessity for aid in the first place. So I think, if we just to look at this, maybe let's take the example of Malawi, a country where PH has worked for 20 years. Um, you know, of course, over the past 12 months, we've really seen the devastating impacts in Malawi and beyond um, because of these funding cuts. And it's, resulting in much less health workers at health centers and drug stockouts and, all of these really awful conditions which result in and which is embodied in sickness, ill health, and really stupid deaths, as Paul would say. And it's devastating, and it's really hard to just say this on a call. Oh yeah, it's devastating. No, like I mean, in some ways, like you need to hear it from healthcare workers and communities,
Patients in the
and
community.
patients to understand it. Yeah. And so then as Rosie just mentioned, governments are going through these MOUs with the US government. So one was just negotiated in Malawi, and it seeks to cut funding levels to Malawi by 35% over the next 5 years. And for context, in recent years, half of Malawi's health system has been functionally funded by external sources, right?
Mm.
By donors. And the largest donor, of course, is the US. So a 35% retraction to Malawi really will have devastating impacts. And well, the answer might be, well, couldn't the government, increase its domestic allocations towards health to kind of fill this gap? And, well, I think currently the government of Malawi spends about $9 per person per year on health spending.
Mm.
It may be possible to get it to $11 per person per year. Maybe that's
Mm.
possible, maybe. But don't for a second tell me that's sufficient for delivering quality care and overcoming these structures. So there's an enormous hole still there. And why is there such a big hole still? Well, we need to understand that currently more than half, more than 50% of government revenue in Malawi is going to paying interest payments on debt alone, just interest payments. Half of the revenue, more than half the revenue.
Mm.
So that's where most of the government revenue is going, right? And if we don't have that in as part of the picture, we're missing so much of what needs to be addressed when it comes to health equity. And if we consider that there's also co-financing requirements as part of these MOUs, where is that co-financing going to come from? Is the government of Malawi
All right.
going to be able to increase that funding domestically, or are they going to have to take out more loans that further perpetuates this cycle? And so for every $1 of aid that goes into Malawi, at least five is going out in interest payments, and at least 10 is going out in like forms of tax abuse, right? So I think this is the analysis we need to have, and then that needs to inform what we do. And so I just, one really big shout out is to the work that the team in Malawi has been doing. They've been
Mm.
organizing national
Absolutely.
coalitions, right? Bringing together intersections across, human rights, health, education, labor, even nurses unions, right, coming together to say on one issue, one consequence of these loans is that the government is not allowed to recruit public sector workers. So you have nurses, midwives graduating from public institutions cannot be recruited in a country that needs healthcare workers more than anyone else. So that the coalition in Malawi is pushing back and saying, you know, at a bare minimum, we have to be able to recruit health workers to our public sector in this moment. This is unacceptable. And so they're just doing a phenomenal job on that. And I think that what we need here is a long-term vision for where we're going as a movement for health equity.
Yeah.
And one that lays out the practical steps to ensure that the development assistance is being maximally used in the short and medium term, and we're doing everything we can to increase that. But also, that there's multilateral cooperation that supports countries to build their revenue base, and build local productive capacity, right? Do the things that means that they can actually use domestic resources to invest in health. Because currently that's not the situation. So if you're removing aid and not allowing that at the same time, the consequences are so destructive and devastating. And so I think it's our job at PH to be part of this movement, part of coalitions that are building this vision. And that's what we're doing. That's what we're trying to do in Congress this week. And I think we should have hope, but our hope, comes from the movement, right? The hope should be as strong as the movement. And I think this week we're really hopeful, Joia, because as you shouted out TV Fighters and Rosie for just a phenomenal effort on Tuesday, 250 meetings with more than 300 folks coming in from all 50 states in the US to tell the elected officials what needs to happen. It might seem like a pebble on the scale, but believe me, it makes a really big difference. So huge shout out for that. Yeah.
Great. Thank you so much, Joel. And thanks for everything you've been doing, and especially the shout out to Team Malawi, who has really taken this to the Capitol Hill there. Such an important set of work. So let's move to our own US Capitol. Dr. Saki, Stephanie, if you could kind of help us understand how current global health policy debates are unfolding, because right now we've got a war going on, we've got a billion different priorities. So how do we understand the US priorities, the political feasibility at this moment? Over to you.
Thanks so much, Joia, and thanks to PIH for pulling this together and for the incredible work that you are always doing in this space, but particularly that you've done in the last year and will continue to do. I think it's really making a difference. So let me share some thoughts, and I should say that before I was a senior fellow at Brown, I was working in global health in the US government. So let me share some reflections of what it's like to try to make these decisions from the inside, regardless of kind of the high level political atmosphere. I think that Rosie and Joel did a great job of summarizing not just this acute crisis, but also this broader these chronic crises and challenges that we have all been working on addressing for a long time. So we're stuck in this challenging position of both feeling like the way things have been done for a long time was imperfect, and also feeling like we need to make sure that lives are saved, and human rights are protected while we rebuild and construct a better system, a more just system in the future. And I think that tension is really woven throughout all of the actions that have been taken and we need to take. So first, let me just say, and this is maybe clear to everyone here, but I think it's important, overwhelmingly Americans support foreign assistance. They support the idea of US taxpayer money going to health, education, humanitarian assistance, a whole range of issues. That is true across the board overall. That is true in different states, regardless of the political orientation of those states. And members of Congress know that. And so I think that's an important just reality to keep in mind. There's a lot of very loud voices that are telling a different story, and that's not reflective of what Americans believe. And then, I think there is so much energy, as we all know, taken by the loud voices, the people who are kind of in the most senior roles who do have a lot of power, as we've seen in the last year. But that's not most of the government. And I think it's important to keep in mind and remember that most people in government are public servants, civil servants who've been there for a long time across administrations and working in this space are people who are deeply committed to saving lives and protecting human rights. And for those people in this space who have managed to still have a job after a very difficult year plus, they are, many of them, I think, are trying to figure out how to navigate this and be as effective as possible. And that is, it's both a kind of defense of many of my former colleagues who have been, I think, it's been a really tough time for civil servants in the last year, but it's also just a practical point, which is that most people that you would be interacting with, and I think this is also true for members of Congress and their staffers on both sides of the aisle, are trying to do the right thing and trying to figure out what that looks like. And while we might, disagree on the most effective approach, I think for the most part, most of the people are on the same page in terms of wanting to save lives. I find that encouraging when I think about that and remind myself of that. So a few things, like keeping that in mind, a few things that I think are important and successful and a result of the advocacy that has happened in the last year and kind of where the conversation is. One, there is a strategy. And while the America First Global Health Strategy is maybe not in a whole number of ways what many of us would have crafted, having a strategy that says the policy of the administration is to continue to pursue these goals in global health is really important and helpful in terms of creating protection for those other people in government to continue doing their jobs effectively. So that is useful and important, even if we might have crafted it differently, and hopefully will craft it differently in the future. Congress, has also, as Joel and Rosie touched on, Congress has sent a clear message with the appropriations bill. And that is not, of course, previously there were clear messages on appropriations, but the most recent bill that sustains much of the funding is a reaction and coming after the actions that have been taken over the last year. So Congress has said this continues to be a priority for us, and the executive branch has said global health is a priority for us. Those are really important for the many people who are committed to this area and want to do the right thing. Maybe I'm feeling optimistic
That's
today.
great. No, we love it. We love it.
I think a big challenge that maybe, we don't spend enough time thinking about, but that worries me, is that they don't have staff and partners to do this work in this moment. So most of the people with expertise, a lot of the people who are there, the political people, but also some of the mid-level people have not worked in this field for most of their careers, sometimes at all. They have not worked in the contexts where PIH has worked and has deep roots and deep expertise. And they don't really, I think, sometimes understand why something that sounds like it should work well on paper is not going to work well in practice. And the people who have that deep expertise, most of them have been fired. And so that creates a real just operational challenge within the US government of doing things well, even if you want to do things well, and if we're making an assumption about intentions. So I think it's important to keep that in mind. And that also is an area where Congress can push in terms of getting clarity on, who do you have there? Do you have the right people? Do you have enough people? Because there is money to have the right people inside. In terms of just like the broader trends, I think we should keep in mind this bigger picture question about what the role should be of the US government. And I think it's really difficult. I mean, I'm sure Joel and Rosie have thoughts about this, but I think it is difficult to be pushing and advocating in issues that are very focused on the acute crisis and also maintain this bigger vision at the same time. And to me, that in part means not compromising on some of the core elements, including protecting human rights for all people. And I think that there are some real challenges right now of the trade-off between prioritizing and protecting human rights and protecting the money that's going to global health. So I think as a community, that's an important challenge to talk about and make sure that we're striking the right balance.
Yeah, that's great. And how do you see the role of advocacy? You know, what we're trying to do. How do you see that being helpful to people like yourself and also, people who are really inside the Beltway?
Yeah. I mean, it's essential. I think this is always true, but it's particularly essential when you have an administration that is not aligned with the goals of many of the advocates. And so I think it seems clear to me that it's not only been important in the last year, but there's many times, including in the Biden administration, when advocacy has been important. I guess just a few. You all are the experts on this, but here's a few pieces of kind of takeaways, advice from my time being in government. One, it's really important to be pushing for a clear vision and not just opposing what is
Mm,
happening.
yeah.
What are the actions that we want to see taken by different people that we are pushing specifically, and what are the actions that are within their power? Again, it's really important to stay aligned, and as a community, that doesn't mean that we have to all agree on everything, but it does mean we can't throw any issues under the bus in order to just sort of make sure that we lock in successes in some areas. And then, really clear and consistent about what we stand for. So if we stand for science and we stand for evidence-based decision making on vaccine policy, then we also have to stand for that when it comes to trans rights, for example. Everyone should be united on the principles that we stand for and consistent in the conversations that we're having.
Thank you so much. Thanks for being part of this webinar, Stephanie.
My
It's great to
pleasure.
have your voice. Rosie, we'll let you close to recap what PIH is doing to respond and how people on this call can get involved in our network.
Yeah, as Stephanie mentioned, advocacy is so important right now, and this movement needs to be as big as possible. A few things. One, come to TV Hill Day next year. You have to work with the coolest people on the planet, advocate, and we're gonna keep going back until TB is like over, right? Until everything was tuberculosis, right? So really want everyone to flag that as an opportunity. Also, if you want to stay committed in this work, you can join with our Partners in Health Engage teams. These are groups around the country that are also advocating for these priorities and working on that shared vision for a better future. Um, Other things you could do right now is contact your congressional offices to ask them to increase funding, right? We know that the budget is a reflection of our priorities, and while we're working for that bigger vision, getting the funding to people today will make a really, really big difference. Last year, PIH helped mobilize over 73,000 calls and emails, and all of those voices are so important in reaching out. Finally, I think it's important to stay informed. Where you put your attention matters so much. But while a lot of these stories are really heartbreaking, I think also I'm always really encouraged by what my colleagues at PH are doing around the world. I was talking to Maxo, who's the executive director in Liberia, about an MDR TB patient named Pauline Baker that he helped secure housing for so she could recover better, right? And so I think when we think about that vision for the future, I think a lot of the PIH sites are modeling that and looking to them for leadership and guidance on what that vision could be like is really helpful to me. And I think really important for us to have their visions when we're speaking in the US to our policymakers.
Great. Thank you so much, Rosie. And thank you to all of our panelists. I think we could talk for another half hour. Next time we'll do this for an hour. But I think what we have learned at Partners in Health is, I would say, this important series, which is listen to the poor and sick, help them to get what they need to live healthy lives, and then take that model, that message that comes from the most vulnerable to the highest levels of leadership and advocate for change. And I think, we know that works. It's worked more than once. It's worked in very difficult environments. And so that is really for us what we are looking to grow this movement. As Joel said, we need to have the movement be about human rights, about health, the right to health, not about single diseases, although single diseases can get us far. And again, so grateful to all of you who came to TB Hill Day. But we are so grateful to this network, this movement, to all of you. And we're definitely going to win these fights. There is no doubt. We're obliged to always stand with the least fortunate, the most vulnerable, and to work with them to ensure their right to health. So thank you all so much.